Hi guys, my name is Bektu Salman. I'm a medical student, so I'm learning to be a doctor at CU. Uh, and we're doing our sort of clinical rotations down here, meaning we're like having our first chance to see patients and everything down here in the springs. And as a part of our program, we're partnering with the place to do these little videos, trying to teach you about some things that we know some stuff about that we think would be pretty helpful for you guys. And me personally, I'm going to be an OBGYN, which means I'm going to be an obstetrician and gynecologist, which translates to I'm going to catch babies and I'm going to take care of anyone with a vagina and uterus and ovaries. And so today I'm going to be talking about something that is really important in the field that I want to go into, and is just like important for everyone in daily life, which is sort of sexual health, and then a little bit about pregnancy too at the end, which I know is a little bit more like niche. It's really only going to apply to people with a uterus, people who can get pregnant. But I'm going to try to keep that brief. I think is really important, so I wanted to talk about it. But I know it doesn't apply to everyone necessarily, so I don't want to spend the whole time on it. So we're going to start with sexual health, and I'm going to focus a lot on STIs and STDs because um, there's something that I think a lot of people have some confusion about. So we're going to start with just a definition. So STIs stands for sexually transmitted infections, which is more what we call them now. They used to be called STDs, more commonly sexually transmitted diseases. Same thing. Um, Both bad, don't want them. And so I'm going to start by just talking about how you get them. So it is exactly what it sounds like. They're infections that you get from sex. So basically, they're either bacteria or viruses that you basically only get from some sort of sexual contact. And that can mean oral sex. For example, there's a virus called HPV that is one of the most common causes of like throat cancers because of oral sex. And then, and then any type of like penetrative sex. So that's like penis and penis sex, penis and vagina sex, penis or vagina and vagina sex. And so there's no way to sort of get around it. You have to use protection in order to not get these things. And sort of quickly about why you should avoid them. I mean, you don't want any type of infection, but some of these can be really bad. They can make it so that you're infertile, meaning you can't get pregnant in the future. They can cause really bad disease, which so like HIV is a sexually transmitted infection. Um, and that is sort of a disease that you will have for the rest of your life. It is treatable, and you can live your full life with it if you get treatment. Um, but it becomes a huge part of your life if you get it, and not to mention sort of the stigma around it as well. And then there's, viruses like herpes, which is another one that you can't get rid of and is pretty, at the very least, annoying. You can treat it, but it's really annoying. Um, there's a really there's one called syphilis too that if you don't treat can cause really bad brain infection. Um, and so it's better to just avoid all of these things if you can. And as far as how you avoid them, it's going to be protection. And that has to be like a type of barrier protection, is what we call it. So, like condoms are a type of barrier protection. It's a physical barrier between either like a penis and vagina, penis and anus, penis and mouth. And then there are other types of barrier protection too, like dental dams. Which are a type of barrier protection used in oral sex. so that your mouth doesn't come into contact with genitalia. And just to sort of dispel like a myth, like one of the myths around STI transmission is that if you take like an oral contraceptive, like the pill, that you can avoid it. And no, the pill just prevents you from getting pregnant most of the time. It absolutely does nothing to prevent you from getting an STI or spreading an STI. Um, and it's the same with any like implantable device for contraception. So something like an IUD, if you've ever heard of it, or a Nexplanon, which is something that you get placed in your arm, or a depot shot. All of those things prevent pregnancy, but they do nothing to prevent you from getting an STI. You have to use barrier contraceptives or not have sex to avoid getting an STI. Um, Hints that you might have one. So it sort of depends on the type of infection. For some of them, you might have some like different colored discharge, some yellow or green discharge out of your vagina or your penis. You might have like a sore, like a small sore on your penis or vagina. Or on your genitalia, could be near your anus. Some of them, like herpes, have like a bunch of, like a cluster, a bunch of little spots that look like they're filled with something, or like they kind of look like pimples. Mm. Sometimes it can hurt to pee. It can seem kind of like a urinary tract infection, a UTI. So it can like hurt to pee, or it can hurt to have sex. Um, those are all possible hints that you might have one. But also some of them you don't have any symptoms, like you don't have any signs. It's everything is normal, and then later on you found out you had it, and it's caused a problem that will prevent you from um, being able to get pregnant in the future. So that's why we recommend that whenever you're able to, you should get tested for a sexually transmitted infection, because some of them don't have any signs. So you may not think you have anything and you might have it. Um, and one of the most dangerous things about that, as far as like you not having any signs and you not thinking you have anything, and so you don't get tested, is that you might spread those infections to someone else, and it might cause really bad symptoms in them that could be really harmful to them. So, like, not only is it potentially really harmful for you in the future, could be really harmful to anyone you have sex with. So another huge reason that I didn't even mention about why you should do everything you can to avoid them is the potential for spreading them. Some of these are really infectious and spread really easily, um, and can do a lot of harm to some people. So it's just for like everybody's sake that you should use protection and that you should get tested whenever you're able to. And then as far as getting rid of them, once you have them, obviously the first step is to get tested, and then they figure out what you have. And for the most part, you can get rid of them. Most of them are um, treatable. With a lot of them are treatable with antibiotics, which basically just kills the bacteria that causes the infection. Um, there are a couple of them, the most common one being herpes, that you can treat, but you'll never actually be able to fully get rid of. So, with herpes, for example, when you have symptoms of herpes, you can take a medication that will basically lessen the symptoms, will make the symptoms not bad at all. And then the herpes goes away for a little bit and then it comes back, and it basically will just continue to do that. Fortunately, herpes isn't super dangerous most of the time, um, unless you have certain conditions, but it is really infectious. It spreads really easily. So, again, if you have it and you use contraceptives, if you use a barrier contraceptive like a condom, um, you are much, much, much less likely to spread it. There's little chance that you'll spread it. So it's best to just use the condoms if you have access to them. And so I think that's all I really wanted to tell you guys about STIs. As far as testing goes and like where you can get things like free condoms, um, I know there are a lot of, it sort of really depends on your area. Some like county buildings will give you free condoms, or like health departments will give you free condoms. I know like Planned Parenthood gives out free contraceptives and will do free testing as well, for STIs. Oh, and the testing for STIs is generally pretty easy. They like just swab, like take a little swab of whatever spot you have on your genitalia, or just like they'll take a little bit of the discharge and they'll test it. A couple of the STIs need to be tested like via your blood. So it's just a little blood draw. It's all pretty easy. And definitely, if you have like any type of federal health insurance, like a Medicaid, you would be able to get those for free, outside of like going to a Planned Parenthood or something like that. Right. And so I think that is all I have on STIs and STDs. So I'm going to talk briefly also about pregnancy. And I just wanted to touch on how you might know you're pregnant, and then like first steps, if you think you are pregnant. So signs of pregnancy, the most common one is you miss your period. But that doesn't really help if you're the type of person that doesn't have your period every month. Like typically you get a period every 4 weeks, but a lot of people don't. They have a period every other month, or just a few times a year. And so, you won't find out until much later if the only thing you're using is whether or not you missed your period. So other signs of pregnancy are like really bad nausea that's like abnormal, like days and days of nausea, feeling like you're gonna vomit all the time, or vomiting really early in the morning. You're not sick, you don't have any fever, you don't have chills or night sweats, or anything like that, but you're just vomiting every morning, before you even eat anything. That could be a sign of pregnancy. Um, Things like weird cravings. You want food and food combinations that you've never wanted before. Um, you are either much more hungry than normal or much less hungry than normal. Those can all be signs of pregnancy. But obviously, you need to have had sex, at least a few weeks ago before those signs show up. Um, and so, but you might also not have those signs if you're pregnant. So, especially if you have unprotected sex without any, without taking the pill or without using a condom or any of those things, a few weeks later, it won't hurt to try to get tested if you can. So, like 5 to 6 weeks after that. Um, Trying to go get tested, which means you can buy a pregnancy test, which is just pee on a stick, and it tells you you're going to want to do at least two of them. But pee on those sticks, and it tells you if you're pregnant or not. Those can be wrong, but a lot of them are really, really accurate. So there's very little chance they're going to be wrong. Or else you can go to a clinic and ask for a pregnancy test, and they can do a pregnancy test for you there. Once you uh, like if you think you're pregnant and you get tested, and you are pregnant, you are eligible for emergency Medicaid. Um, so that means all of your prenatal appointments, which are appointments that you have with a doctor to check to make sure that your pregnancy is healthy and that you're healthy, and they happen really regularly throughout your pregnancy, those are all free under emergency Medicaid if you are pregnant, so you don't have to pay for any of them. And then if you have like limitations on how many of those appointments that you can make, or it's hard to get transportation, um, it's best to just let your doctor or the nurse or whoever at the clinic that you're at know, and they can tell you which appointments are the most important. They can do what they can. They can get you transportation to the appointments. You can get through Medicaid, you can get transportation to your appointments that's free. So there are a whole bunch of like resources and things to help you once you're pregnant, if you find out you are. So I think that's all I had to cover today. Um, if there's things that you want to know about these topics that I didn't cover, or if you feel like you want to know more information about some of the things that I mentioned, please just let some of the staff at the place know. They have our contact information, and we can get you guys more information if that's what you're interested in, or if you didn't find this to be very useful and you want to learn about something else. Again, just let them know, and they can let us know, and we'll do what we can. Thanks so much for listening, guys. Appreciate it.